So next we'll talk about macrocytic anemias. So a really common cause for macrocytic anemia is B12 or folate deficiency. And clinically, they can be suspicious of one or the other because B12 usually has some neurologic symptoms. So some tingling in the hands or feet, things like that. So when we get a blood smear, you'll want to make sure that you have the red cell indices, and so that should show a MCV greater than 100. And so it's always good to just check and make sure what a normal MCV for that patient is, because everyone runs a little bit different for their own normal. And so if you see an MCV greater than 100, we can call those macrocytic red cells. And if the red cell count or hemoglobin level is low, we can call it a macrocytic anemia. And so let's just talk about a few features of macrocytic anemia. So here at the feathered edge, we just make sure that we're not missing anything. And then we find our zonal morphology here again by going 10x fields in. And we'll go a little bit further and we'll go higher power. So it's very difficult, again, to determine a red cell size based on microscopic morphology features alone. But if you're lucky enough to find a nice mature lymphocyte in a field, you can see that some of these red cells are larger than the lymphocyte nucleus. But again, we don't want to use just our eyes as a measuring tool, and so you want to make sure that you have those red cell indices handy to make sure that this is a macrocytic process. So you'll see ovalocytes, so larger cells that aren't maybe perfectly round but show kind of oval morphology. Other things that you'll want to look for in a macrocytic anemia is things to indicate a B12 or folate deficiency. And so that would require you to look at your neutrophil population. And so what you're looking for is neutrophils with too many lobes. And so this one has almost 6 distinct lobes. If we're being real strict with our rules, this is not quite a hypersegmented neutrophil, but it's pretty close. And so if you start seeing things like this, make sure you mark them so that you can come back and reference them later. But just seeing one with 6 distinct lobes is enough to call rare hypersegmented neutrophils consistent with B12 or folate deficiency. And so let's just go around a little bit and see if we can find any more. So here's another one that's maybe a little bit too segmented. Remember, our neutrophils are only supposed to, in a normal person, have 3 distinct lobes. Here's a good one. This is probably enough to call it a hypersegmented neutrophil. And so this is a good example of a B12 deficiency. But as you can see, some of the neutrophils will have 2 lobes. We'll see band forms. We'll see some neutrophils with just 3 lobes. So you're not going to see it in every neutrophil. And you're going to require the clinical and ancillary testing to make the diagnosis of a macrocytic anemia due to B12 deficiency. Additional causes of macrocytic anemia include chemotherapy, especially those that inhibit purine and pyrimidine synthesis. If the person has intrinsic factor deficiency or pernicious anemia, and some congenital enzyme deficiencies. Not uncommonly, you'll see anisocytosis, poikilocytosis. You can often see leukopenia and thrombocytopenia, and the white cells also might appear to be larger than normal. Please remember, if you see any dysplastic changes in any of the cell lines, this could be indicative of a myelodysplastic syndrome, which is a myeloid neoplasm. And lastly, in B12 deficiency, there sometimes can be seen red cell fragments. And so you'll want to be sure that you're not overcalling red cell fragments in a case where the B12 level is very low. This is a common finding in severe B12 deficiency, and even on this smear, you can see some red cell fragments or even small, really small fragments of red cells. Additionally, if the B12 deficiency is combined with iron deficiency anemia, the red cell MCV may be normal. And so that must be taken into consideration. And so it's always important to look at your white cells to see if there's any megaloblastic change, especially within the neutrophil lineage, which would include hypersegmentation and overly large neutrophils. B12 deficiency combined with iron deficiency anemia is a very tricky situation and may require further ancillary studies.